Hi, it's Dr. Joel. A lot of people who come to us in my office in Naples, Florida, they come for a variety of reasons. They'll contact our office because they're struggling with certain health conditions. And I've found after 20 years of dealing with people is that you can, a lot of times, look at different patterns of symptoms that people are struggling with and really boil them down to maybe one, two, or three fundamental, basic underlying causes to those symptoms. And so today, I want to talk to you about one of those underlying causes that are very important, and it's high blood sugar. So high blood sugar leads to diabetes, and there's a huge, huge problem with the way that we take care of diabetics today in North America. And so I've felt like it's been super beneficial for my patients to understand how they create it, first of all, in their bodies, and then they can make better decisions on how they take care of themselves. So take a look right here. Okay, I'm going to draw a beautiful cell for you right here. And that's a cell in the human body, and there's 50 to 70 trillion of those in the human body. Now, these hair-like projections around the cells are insulin receptors. Right? So when you eat something, that something gets broken down into sugar or glucose. So I'll put G for glucose. And then the glucose circulates around in the blood. And in order to use the glucose as energy, we need a hormone called insulin, right? So the pancreas secretes a hormone called insulin, and then insulin comes and attaches to the insulin receptors right here. And once it attaches, it opens up the cell, and the glucose can get into the cell and be converted into energy. And that's how it works. So we eat glucose, right? And glucose releases insulin, and then we get energy because of that. Now, the problem is the standard American diet, right? Because in our diets, we have higher levels of glucose. So in order to accommodate those higher levels of glucose, we need even higher levels of insulin. Just think about it for a second. What do most people have for breakfast? You know, most people will have, toast, they'll have cereal, maybe they'll have a bagel, or you'll have coffee and you'll put sugar in your coffee. And so that's high sugar levels. And then the snack, well, apparently some people even have potato chips for snacks. I didn't know that, I just learned that today. But some people will have like a Nutri-Grain bar. And if you look at the ingredients, there's super high sugar levels in that. And it might not be the sweet sugar taste. Most sugar that we get is actually through grains, right? So flour, oats, those types of grains, within 4 seconds of touching your mouth, you have an enzyme called alpha amylase that starts to break it down into sugar. And so for breakfast, like I described, for snacks, for lunch, we're having a sandwich. For dinner, we're having pizza, we're having pasta, we're having rice, we're having potatoes. Within seconds, that turns into sugar. Even though it's not sweet sugar, it still is. Now, here's the interesting thing, right? Most people in America are right here. Okay, if you take a blood test of this person right here, they will have normal glucose levels, but they will have high insulin levels, but we don't test insulin on blood tests, we only test glucose. At this point though, this is the type of person who's really tired after they eat. So they might be like 2 hours after eating, they might be wanting to fall asleep at work or fall asleep in class or difficulty paying attention, right? This person will have struggling to pay attention. This person might even have, with high insulin levels, will have joint pain and achiness because the sugar is also acidic, so they'll have high acidity. Now they'll go to their doctors, they'll run the blood test, and they'll say, no, there's nothing wrong, you're totally normal. Now if this continues over time, because of the high insulin levels, the cells, you'll end up burning out the insulin receptors. So instead of having an abundant amount of insulin receptors, you'll have very few of them. And so, excuse me, it takes a lot of insulin to open up the glucose to get them into the cell. So essentially, you'll have to create even more insulin to get them into the cell, but all the glucose won't be able to get into the cell for energy, so you'll have circulating glucose, it'll go up in your blood, and now you'll get a diagnosis called diabetes. So once you get the diagnosis of diabetes, it's very simple. You go from one medication, usually metformin, and that'll lower your blood sugar. And it lowers your blood sugar because, to put it in very simple terms, it will help stuff more glucose into the cell. And then that's going to wear out over a couple of years. So after a couple of years, you go from metformin, then they add another medication, maybe a glyburide or something like that. And that's going to help stuff even more glucose into the cell. So it'll normalize your blood sugar again, right? And then you'll go to 3 and sometimes maybe even 4 medications. But every diabetic over the course of their life will end up having to inject insulin to force more glucose into the cell. This, to me, is an absolute insane way to deal with diabetes, because if you look at how it works, what's the cause? Like, think about it for a second. The cause is too much of this. And so if you remove this right here, which is sugar, from your diet, well, guess what? Your body is actually designed to heal and to be well, right? So your body can recreate new cells with healthy insulin receptors that look like this. But it needs to be given the right environment. It requires just a basic understanding of how this disease process works. And once you get to the fundamental underlying cause, in this case is glucose, not only are you going to think clearer, you know, not only are your pain in your joints and your acidity in your body going to improve, but you will literally and physically and on blood tests, you will reverse your blood sugar and reverse the disease called diabetes. That is possible. So don't believe anybody else that tells you it's not possible. It is possible. I have many patients every week, every month, who bring me their blood tests and say, hey doc, I'm no longer diabetic, right? And that's amazing stuff. I just wish everybody knows about this, and I wish everybody followed these simple steps to reverse diabetes. So please, if you know somebody who has diabetes or who has the sugar problems, who are having, like, you know, the cognitive issues and the joint pains and those types of issues, even the weight gain issues, please share this with them so they can get on the right path, because you can reverse diabetes. You just need to understand the basics. So share this, like it, just do whatever you need to do to get this into people's hands. And I'm available for you guys if you need me. Thank you so much for paying attention. Stay tuned for the next one.